Hello, I'm Robert, a fact checker and science blogger, and helping people scared of things. This time about COVID, and I'm been watching the World Health Organization since January, when the people in our group, Doomsday Debunked, they started getting very scared of it already back then. So I've watched every single press briefing since then, and this is about the very last one, the last one of this year, and I'm trying to give a good saying what they actually said in this, which has been being reported in a rather gloomy way. And so we actually explained there's actually a huge amount positive there, as well as lots of things that we have to be careful about. And I'm sorry, this is going to be there's quite a lot of things to explain here, and I'm just trying my best to explain them as simply and quickly as possible, but this can't help but be a little bit complicated, this video, so I'll do the best I can to try and explain the background. So, first of all, the good news: the new vaccines are more effective than expected at stopping symptomatic disease. We know that hasn't changed. The remarkable 95% with Pfizer and 90% with AstraZeneca too, if you use the low dose, high dose regime. And over the next few months, so this is the priority, and that's what the World Health Organization says our priority for the next 2 months. We've got these vaccines that greatly reduce severity, so we can vaccinate especially the most vulnerable people and eventually everyone, and we can make it a much less severe disease. We can make it 20 times less severe, or 10 or 20 times less severe. So not just stopping the much less people going to ventilators and much less people dying. So by the end of the spring, then most of the vulnerable will be vaccinated throughout the entire world. And that's another great success. COVAX is going to be able to vaccinate the entire world, together with the richer countries. Certainly that far, they've got enough for 20%, so they'll certainly be able to vaccinate all the vulnerable throughout the entire world. Should be vaccinated late spring, then we should get to the point where everyone vulnerable, the elderly, the ones with various conditions that predispose them to be more vulnerable, they're all going to be vaccinated throughout the world. Anyone who wants to, sometime late spring. So it'll be a much less severe disease by then, for the vulnerable people, for the elderly and so on. So that's one positive thing. And with the variants we're getting, the virus is not getting any more severe. And the vaccines are likely to continue to work. There's a small possibility we need to replace the spike at some point. That is a relatively straightforward process. So I'm going to talk a little bit more about that a bit later, but that's just hint on what's coming. And then the big multi-country trials. Now this was a great success. It wasn't a success in terms of the drugs. The drugs, sadly, were not shown to be effective with these trials, but the trials themselves showed that this method works. And this is a remarkable new thing, never been done before. Testing 4 drugs against placebo, which is that you're not actually being treated at all, across all many countries in the world simultaneously. And this lets you test the drugs against each other for the effectiveness and with the placebo. And this is a very, very good way. And it also tests you in all these different conditions, not so much their ethnicity, their genetic makeup. That could be a factor, but it's not very much of a factor. It's also the different conditions. They have different illnesses. They have different they're very different conditions in sub-Saharan Africa or in the United States, say, of the people there who are being protected by the therapeutics. So this is a very remarkable thing. It's very good in terms of equitable testing of the virus, of the vaccine, so that we get drugs that work everywhere. And we find if a drug works in particular conditions, we find that out as well. And another thing that hasn't changed, we know that New Zealand and indeed a fifth of the world is virus-free, and any country can still do that. The same public health measures as New Zealand used still work. And any country that rigorously does this, that does the test, trace, supported isolation, supported quarantine, physical distancing and mask wearing, they can copy what New Zealand did, they can copy what Taiwan did, they can copy what Laos did. And hopefully we'll see more countries join them. And they can do that without a vaccine. That hasn't changed. And we can all continue to protect ourselves without a vaccine. Indeed, if you do the physical distancing and mask wearing, you do that very well, then you can achieve much better than the vaccine. The World Health Organization, when they went all the way around the worst areas in China, none of them got it. And taking similar precautions to what we do. So what has changed is that the virus seems to mutate faster than previously expected, although not nearly as fast as flu. Now, this was the surprise of the new variant in the United Kingdom. It didn't necessarily arise in the United Kingdom, but it was detected here because we do more genetic sequencing than the entire rest of the world put together in the United Kingdom. It's one thing the United Kingdom has done well. So what they found was a new variant, and all the previous variants was just usually like one amino acid change or a couple of amino acid changes, and a couple of that means a little sequence of 3 bases has changed significantly so as to make a new amino acid. And but this new variant had 14 changes all at once, and this couldn't have arisen by chance, except the possibility that they think it's very likely that it evolved in someone who was immunocompromised, who kept the virus going in their system and was kept fighting back at them all the way through for months on end. And after that, then you can get a lot of changes built up, because the virus keeps fighting back against the immune system fights back against the virus, and they learn from each other. And so over that time, then the virus can develop lots of new mutations. And then this person, whoever it was, can't have been isolated, because they then infected someone else at the end of the process. So we're talking about someone who was immunocompromised, had the virus, was still shedding it, and wasn't isolated, and then they gave it to someone else. So given that situation has obviously happened and can be expected to continue to happen, then this means that the virus can mutate a little bit faster than expected. It is nowhere near as fast as flu. So with flu, it's especially evolved it's a special design of virus that it can evolve very, very quickly, and you get lots and lots of variants, and then they change very quickly from one year to the other, and that's why it's so difficult to vaccinate against flu. COVID is not like that. Coronavirus is they've got an error correction. They don't optimize to change quickly, not at all. They optimize to be rather steady and not change much. And they're much more like mumps or measles or polio. Polio vaccine still works from the 1950s, and the other ones are still several decades old. This exact same vaccine still works. So it's between the two, and so this in terms of the effect on vaccines, you don't expect those 14 changes are not going to make a significant difference to the vaccine all in one go. They might. The way it works is that that's only 14 changes out of just short of 30,000. Although it's 40 changes in the amino acids, I'm not quite sure how you count it. The 30,000 bases anyway, and anyway, it's just small changes in, and some of them in the spike. The spike is immensely complicated, a very vast, complex thing, and the antibodies. What happens? The vaccine presents your body with the spikes, the protein spikes, and then your body then generates antibodies to those protein spikes. The protein spikes are harmless, but your body doesn't know that. And on their own, separated from the rest of the virus. They're completely harmless, so your body develops antibodies against them, but it develops antibodies to lots of different parts of the virus. And it's like a complex clockwork machine. If you stick something into any of the cogs, then things will stop working. So if you just got some of the antibodies, then just any of those antibodies would stop it, and it does antibodies to lots of different parts of it. And then the changes may affect just a few of the antibodies could be affected by these changes, and that's all. So the immune system will still be able to stop it. So it's not likely. The main thing is you wouldn't expect a suddenly that the vaccine suddenly stopped working. You could expect a slow drop off of the 95% figure of Pfizer slowly goes down. Not that it's suddenly not going to work as a vaccine at all. That's not very likely. So in terms of vaccines, then as I said before, so we can the vaccines are likely to so the question of the vaccine, how long is it going to last for? It could last for 6 months. We're pretty sure it lasts for 6 months because of the phase 1 trials and because of other information. The question is it going to last for a year, or is it going to last for 2 years indeed, or maybe even a little bit longer? Eventually, this kind of virus, it's not going to last forever, not just because of the changes, but also because our body forgets the virus. So we may need to be reboosted with exactly the same vaccine 6 months from now, or a year from now, depending. Exactly the same vaccine. Or if it escapes the vaccine, we may need to boost it with a vaccine with a new spike on it, which generates new spikes. And so we don't really need to worry about the vaccines. And there is a possible, I'll just go in the direction of bullet points so as I don't repeat myself. So the virus may be getting more transmissible with the new variant, but we don't know. The UK has very low compliance with public health measures, sadly. And we saw that recently with the news story of people from the UK in Australia and causing a bit of a scandal there by having a party completely contravening the local rules in an area where Australia is very, very strict. If you get just a small, because they're pretty much virus free, and then you have these occasional outbreaks, then just go very hard in and stop them straight away. And so but people from the United Kingdom were just partying away and just paying no notice to the restrictions that have been put in place temporarily to stop this new small outbreak in Australia. And coming from Australia, United Kingdom, you can imagine them thinking, with 29 cases or whatever it was, what's that? Let's party away. But that is quite sadly is also happening in the United Kingdom too. And so they're talking about possibly expelling them from Australia for doing that. So other parts of the world take it very seriously, but in the United Kingdom we're not taking it seriously. And if you look at the data that suggests the virus could be getting more transmissible, then actually the very worst was an R naught of 3.5, higher than the kind of natural 2.5. And those two regions didn't have any of the new variant in it. Or almost zero, it's impossible to tell because it was just a proxy. It was either zero or almost zero. So this shows that the United Kingdom, the reason our cases are surging in the United Kingdom is not because of the new variant. That is just people making excuses. The reason is because of this very low compliance in some areas, indeed in many areas. The people are just not doing physical distancing, not wearing masks, having these parties against the guidelines, not getting tested, not isolating if they are tested, not quarantine if they're contact, not helping to find contacts for themselves. It's very low compliance for all those measures in the United Kingdom, and the only thing we do have compliance with is lockdown. The United Kingdom is very good at complying with the lockdown, and that's why we're in lockdown, why we're so often in lockdown in the United Kingdom, because people comply with lockdown and they don't comply with the other measures. So the government is constantly putting us back in lockdown. The other measures are just as effective, indeed they're more effective than a lockdown, but because we won't do them, then they keep putting us in lockdown. And I think the reason is because an awful lot of this is because of we are very attentive to the United States, and we have news story after news story about the United States every day during Trump's campaign. We had these videos of the rallies and people not doing physical distancing and not wearing masks. And we are herd animals, so it's no surprise that with every day whenever you turn on the TV, you see people not doing physical distancing and not wearing masks. That has an effect on herd animals like us at a non-logical level. then people just start saying, well, if they're not going to physical distancing, why should I? Something like that, and they don't really understand the seriousness of what they're doing. And so that's basically what's been happening in the United Kingdom. That's why I think when Biden becomes president, then it's going to be a very different thing. We're no longer, Trump is not going to be on the TV anymore after 20th of January. He's going to be a past president, and past presidents aren't very often on the TV. So coming from the 20th of January, we're going to have Biden, and he's rather like Jacinta Ardern, who, if you've seen any of her podcasts, I recommend you have a look at one of them if you haven't, then she communicates directly to the heart, to the people, and saying this is why we're doing it, and this is what we have to do, and this is what the science says, and just very clear and straightforward. And even with all our press conferences in the United Kingdom, we haven't had that attitude. Boris Johnson is not communicating like that, not in the way that Jacinta Ardern did. And many people I know from talking to them just very unclear about even why they do what they do, or what they should do in the United Kingdom. We don't have that clarity of message. So anyway, that is that is the reason why it's surging. And the positive side about that is that if we really take it seriously, we can bring it down. And the new variant may be adding just a little bit to that, but it's very hard to disentangle it when there's so much else going on. When you've got an alarm note of 3.5, then amongst that very noisy signal, how can you tell for sure that an increase from 1.1 to 1.5 in some regions is due to the new variant? It's very, very hard to do the science. And it's going to take a few weeks before we disentangle it and find out whether it really is a little bit more transmissible, and if so, by how much, or how much of that is just a kind of statistical fluctuation and other effects such as founder effect and various other ways that you could get the same signal. So it's very difficult science, and we expect some weeks before we actually get it sorted out. By analogy with the other coronaviruses, now this is one kind of positive side of the fast mutation, is that the end point of evolution may be a very mild disease like the cold. Now this is not necessarily the same for all viruses, so you have things like smallpox and polio and measles have been with us for a very long time, and they haven't evolved at all, to not even over decades, not even over centuries. They don't become any less severe. So you get some people saying, oh, viruses always evolve to be less severe. It depends on the virus and how it's transmitted, and whether it's a benefit, because it can be that the person with the severe virus still infects others, and this severe virus can lead to more shedding, or even if you're dying, and if it's something that spreads at the end of the disease. So it depends very much on the disease as to whether it's going to evolve to be less severe. It seems with flu, it seems that it probably does, and with that it's about the end point of what could be more severe in the past. With coronaviruses, all the coronaviruses are very mild, all four of the ones that are now in humans that are, and this OC43 may be the most recent to have got to humans. It seems to have got to humans in the 19th century. Now the big question is, was it always mild, or did it start off being more severe in the 19th century? And there's some indirect evidence that suggests it might have been much more severe for a few years in the 19th century. It's rather indirect. There was a pandemic in 1890, which came from bovine coronavirus, and it's very slightly changed from that. And looking at molecular clock and how little difference, we think it probably jumped to humans sometime in the 19th century, and their best guess is 1890. So if you go back to 1890, you find that there was a big cull of cattle because of a big outspread disease amongst cattle, which probably was bovine coronavirus. And then that would be an opportunity to jump to humans. And then if that happened, then there was also a big pandemic in the same year, 1889 to 1890. And that pandemic had neurological symptoms, and which is very unusual for flu. And OC43 has an affinity for the neural system, although it's now very mild. So it could be that OC43 back then created a very severe disease. And then, if so, then it may have evolved very quickly to be mild. So, but there's no alternative. It could be an H2N2 flu, the pandemic, because of antibodies in old elderly people, that they managed to, very old people, that actually survived that they managed to get the antibodies before they died. Anyway, so so it's possible that, so when you get this news story saying it could become endemic, then they mean it could be like that. It could be that even within a few years, if that really was OC43, then it may be not impossible that the coronavirus in just a few years could become much less severe. Combine that with us doing the therapeutics and the vaccination, and you do have a possible future where we end up having 5 coronavirus colds, one of them being what was originally COVID. So that is a possibility. We don't know. So that's what the World Health Organization are talking about, that we may have to live with it. We may, the vaccination of everyone is going to happen. So they were talking just a few months ago, and it's still there's a possibility. They were talking about how we had a golden opportunity. We had a beacon of hope they used we could eradicate it from the world, and then based on that, eradicate other things with vaccines as well. So that hasn't actually gone away. We can still vaccinate everyone. The question really is, will the vaccine stop it? So we're still going to be doing the vaccination. That if it was a measles vaccine, would certainly stop it. So, but the question is, will it work with the COVID-19 vaccines? And so the preliminary data from AstraZeneca was somewhat disappointing. And with both doses the same, only 4% of transmission is stopped. With the low dose first, 59% was stopped. That is not enough to stop with vaccination alone, although if you combine with other public health measures, it is enough. And 70% at least is needed, and if the transmission increases, then it could be more than that, maybe 80% or more. So, if the transmission increases, which means you have a high negative R naught, with measles it's 18, the R naught. So R naught increasing from 2.5 to maybe 3, for instance, it certainly could increase. And if it is evolving rapidly, and so we might need a higher efficiency, higher stopping of transmission. So then when we talk a little bit about that's not optimal. I'll pull the bullets and then I'll talk about it in a minute. So we may need to live with the virus, controlled by vaccine, therapeutics and other measures. So anyway, the focus is to vaccinate the vulnerable first for the next few months. That's what the World Health Organization said. After that, we have to decide whether to go for the moonshot of eradicating the virus. So then a couple of comments there. First of all, and I think he did a very carefully chosen phrase there, the moonshot actually did succeed with Apollo. And we do have the finance and motivation to succeed at this moonshot too. So when my client said a moonshot, forget the word moonshot, sometimes used to make it something that's impossible, but it's actually something that's possible. It can be done if you put the work into it. And so I think the World Health Organization is still reasonably optimistic that we could do it, but we can't decide right now because we need more science, and we also need more. It's partly science, partly sociology. We've got to see how can people in the United States, United Kingdom, and so on learn to take more to actually do these public health measures, because that will make a huge difference if we do start using them. And this moonshot might well depend on that. So if it's the 59%, and that's all there is, the moonshot will depend on the public health measures and whether people can comply with them for a few weeks once the numbers are very low. And then the other thing is, they didn't say that, but this is my comment now. I'll try and distinguish what's my comment, what they're saying. So that 59% is not likely to be the highest possible. They didn't actually talk in the press briefing about that. Hopefully they'll talk about it some more in the future, about what the possibility is for increasing the vaccination percentage for stopping transmission. Well, that 59%, you've got the big difference of 4% with the two the same, and 59% with the first level being a half dose. It seems very unlikely that having exactly a half dose is the optimum here. You know, if you draw a graph, then you have 4%, then you go up to 59% at the half dose. It's increasing from 4% to 59%, assuming it's reasonably linear. And is it going to increase, you know, if it's a quarter dose, does it increase or does it decrease beyond that point? There'll be a maximum, and it's not necessarily going to be half a dose. So even just like that, 59% is not likely to be the highest possible. But now if you go and look at the reason why a half dose worked, then it's probably because our immune system stops the delivery system. So the AstraZeneca has an adenovirus from chimpanzees which can't infect humans, and that's the delivery system. What it can do, it can get into human cells and deliver the DNA into the cell, but it can't replicate and get out again. And then the DNA, when it goes into the human cell, then creates messenger RNA, which then creates the spikes, and after that it's very much like Moderna and Pfizer. It fills your body with spikes, your body attacks the spikes. So if your immune system will develop an immune response to the adenovirus. If your body stops the adenovirus, it never gets to see the spikes, so the vaccine doesn't do anything. So so the adenovirus then, so then it could be that the standard dose followed by another standard dose, the second standard dose is less effective because your body already recognizes the adenovirus. So one way they're trying to deal with that is by, they're going to try using the Sputnik V, which is different, using a human adenovirus for the first one, and then the AstraZeneca for the second one. If you could do it the other way around, then that might, and then the standard dose for both, then that might well be more effective, because if that's the reason, then the second one would be a full dose, and the first one would be a full dose, standard dose, and the second one would work just as well, because you don't have the immune response to the adenovirus delivery system, because it's a different adenovirus, and different adenoviruses need different antibodies. So that's one way that it could be improved. And then we've got all the other vaccines as well, and then trying different doses and so on. So it seems quite likely that 59% could be increased. For instance, Pfizer haven't tested yet, but they had much better, they had 95% compared to 90% for stopping this serious disease. And then they could well have a similarly much higher for stopping transmission. We just don't know yet. So, and then, and they're both working the same way. The AstraZeneca is presenting the spikes, and Pfizer is presenting the spikes. They're both doing these two doses. It might be that this swap of having Sputnik first means it's just as effective as Pfizer. We don't know yet. So it could be that AstraZeneca could be made much more effective. And so we just have to see what happens here. Now, another comment, I'm not sure I've written it down there, another comment is that, yeah, I haven't put this bullet point, but I say it later on in the article. Then another comment is that the asymptomatic disease, with the actual natural disease, there's been very little by way of asymptomatic spreading. Pre-symptomatic, yes. A lot of people infect others just before they develop symptoms. But if you go back into the cluster busting and kind of cluster tracing, then, and the test trace isolate that New Zealand did, it would have been nowhere near as effective if there was a vast amount of asymptomatic spreading. So we know a lot of asymptomatic cases of COVID-19, but they don't seem to be doing a lot of asymptomatic spreading, because we just wouldn't see the patterns that we see in the way that it is spreading if it was spreading from asymptomatic cases. Test trace isolate wouldn't work nearly so well, and then in places where they test everyone, like in Singapore, then they would have spotted these asymptomatic cases, these lots and lots of clusters arising from asymptomatic cases. So then, if you look at and these are my comments, not from the World Health Organization. They didn't go anything like this level of detail. Hopefully they do in the future. But the asymptomatic cases may well if they've managed to use, if the vaccine turns what could have been quite severe into asymptomatic, or symptomatic into asymptomatic, it's possible that that is also reducing the transmission as well in asymptomatic cases. So this is different from the 59%. The 59% is the reduction of both of asymptomatic and symptomatic cases together. Both of those are actually reduced. So with AstraZeneca, they showed that they weren't even asymptomatic cases amongst the vaccines, 59% reduction in all cases. But what amongst the remaining whatever it is, 41% that haven't been removed, then if those are largely asymptomatic, then the asymptomatic cases may not transmit to other people. So it could be, if they've reduced, if they're 90%, it could easily be their 90% or even more than that, because if it could even go the other way, if you look about transmitting on to other people, because the severe cases were greatly reduced, possibly more than the 90%. It's hard to say because there's so few numbers, but it could be that the vaccine across all the cases is actually reducing transmissibility to others. So there's two questions: are the vaccines reducing the number of people who get the disease but are asymptomatic, and then is it reducing how easily it is for people who've got the disease to transmit it to others? So it could even be that even the 4% reduction that we got with both doses the same, it could still be making the people who were vaccinated, they might be much less transmissible to others. So it's really very difficult to do the science here, and I think there's lots of possibility that it's actually more effective than it seems to be as well, because of the past experience that asymptomatic spreaders seem to be very rare. Pre-symptomatic quite common, asymptomatic spreaders are very rare. So I think that there's a real possibility that the vaccine actually are more effective at stopping transmission, but we won't know this until the late spring. But in terms of actually what we decide to do, then the first people are definitely the most vulnerable. And then obviously if you have a super spreading event, we might actually get some evidence before then. If you have a super spreading event and they go in and stop it with a vaccine, that would make sense, even with limited amount of vaccine. And then maybe it'll turn out to be more effective than expected when it does that. Even if they're just doing it to stop the severe disease, but then it may actually stop the transmission as well. So this we won't know until the spring. Probably be another few months before we know if it stops transmission, because the science has to be done. It hasn't been done yet. And then the other thing to bear in mind is, if we're looking for a future where, for instance, say the United States and the United Kingdom decide, we're going to let it be endemic, but the other people in New Zealand decide not to, then New Zealand they're not going to let people come in with a vaccine if they're vaccinated, if the vaccine doesn't stop transmission. So we could be headed to a future where part of the world stays virus-free, and the other part are considering whether to make it endemic. So that could be quite an awkward situation. And then maybe gradually one country after another eventually decides to go virus-free, and decides to move the other faction, as it were, in terms of how the world is dealing with this. So, but actually, yes, I don't seem to have brought that up. Hopefully I won't take COVID Act Now. I just want to bring up the COVID Act Now page. Here we are. I'll start by say why when I get to it. So, and what I talk about it down here. Oh yes, here we are. Yeah, I think it just came up. Right. So what I'm going to show you and there is, if we look at the infection rate here in United States and look at the R0 there. I said United Kingdom in some local regions it's very high, but if we look at now California, it was up to 1.3 but it's different if you go over the entire country, and it's not so high. And if you go to the United States, and they managed to bring it down hugely. There were only, not so long ago, there were only about that number that had R naught less than 1. Now it's less than 1 in all of them, except Virginia, Georgia, Maine, New York, South Carolina and California. And look, the very highest R naught is 1.05. This means that if they can stop, if California can stop another 5% or 6% transmission to go just below, then they can have decreasing cases per day. So just a little bit more care about mask wearing, physical distancing in California, where they're not very well compliant to it, they're a bit like the United Kingdom, a little bit not very good at complying, then that could tip it over and it'll start coming down in cases per day in California. So my point here is that if you can manage, and then even at worst in the autumn when it was going up and up and up, it was still only about 1.3 in the worst cases places in the United States, and that's like 30% reduction, takes you down to 1. So if you've got a vaccine that stops 59% of transmission, and if you can vaccinate nearly everyone in an area where there's transmission going on, and then if you can do public health measures to bring it down even to 1.3 or 1.5 even, and then you add your 50% on top of that, then the cases can be going down. And then the mathematical thing is that if the R naught is less than 1, the vaccine is eventually going to go away. It can never start going up again unless the R naught increases above 1. So if you can keep the R naught below 1 and just keep it and keep it like that, eventually it'll be gone. And so if with the aid of a vaccine plus public health measures we can get the R naught below 1, then we can eradicate it. And if we can get it significantly below 1, we can eradicate it very quickly. New Zealand stopped it, had a 10-fold reduction in 25 days with an R naught of 0.5. And if someone did as effectively as New Zealand, then add an extra vaccinating nearly everyone as well, then you could do it even faster, maybe do it in a couple of weeks. You could have a 10-fold reduction. And so that would be like a 1,000-fold reduction in 6 weeks, 2 months, and you got a 10,000-fold reduction. If you to vaccinate everyone and use as effective public health as New Zealand had, then it seems not impossible that you could have 10,000-fold reduction in daily cases in just 2 months, plus an extra 2 weeks delay before this all starts taking effect. So if you think about it like that way, and then the vaccination also, we can have targeted vaccination, so we don't need to target the entire population. If you target, so if you can bring it really way down, like we did in the United Kingdom early on in this year, then you think World Health Organization say that you've got to keep on going down beyond that when you get to that point. Don't stop, keep going down. When you've got to do what Australia do, when you're down to just 29 cases or whatever, going really hard like Australia did. And that's the way to eradicate it. If you start easing up at that point, then it'll just start rising again. Now, if we have a 58%, a 59% of stopping transmission vaccine, and we get it right down to a few cases per day, and then if we just ease up, and we say, oh, well, that's fine, we're okay with it at a few cases per day, and you ease up, and keep on easing up, and the more, and ease up as much as you possibly can while keeping it at a few cases per day, then you are targeting keeping it endemic. And it's just going to go on and on and on in your population. It's never going to stop. But if, once you've got to a few cases per day, you then say, well, we're going to stop this, and you keep up with your public health measures for another few weeks, then you can eradicate it. So they're saying when you got down to, say, 10 cases a day, 2 cases per day, 1 case per day, they say, keep on for a few more weeks and get down to none. And then once you have cases come in, and if you get and do what Australia did, if you get an outbreak, then come in hard on the outbreak and stop it right away. and put everything you've got against it. Really go all out and stop it. It's like if you're at war and you have some insurgents, you have paratroopers that fall in your country. Then you don't just say, oh well, only half a dozen paratroopers, we can ignore them and just go around your business. You go and stop them, and it's the same with the virus. So once you're down to no cases, then you do what Australia did, and soon as you've got a few cases arise again, go in and stop it. And that's the way to go virus free. And so this is well within, and we can definitely do that. It really doesn't matter. Remember we can do this without a vaccine, and a vaccine will help. So it's all a case, and that's what the moonshot is about. So that's why Mike Ryan said, he said it's not just the vaccine. It depends. If we have a very, very effective vaccine, we could stop it just with a vaccine, if it's very effective at stopping transmission. If it's not so effective, then it depends on the sociology as well, as to whether people comply with the public health measures and whether governments target endemic or target elimination. Basically, it's a decision that's going to be made. It's not up to the virus, it's up to us. So when they say likely to be endemic, that's like a self-fulfilling prophecy. If they say, okay, we are satisfied with making it endemic, then it's likely that that's what happens. But if countries decide we're not satisfied with making it endemic, we're going to eliminate it, then we can certainly eliminate it. We can eliminate it without a vaccine. So the World Health Organization can't predict that. They can't predict what governments are going to do. So it's a dependence. It depends partly on what governments decide to do, and then partly on the science. If we do get a very effective vaccine, then we can predict that we're going to end it. If we can have an effective vaccine that stops transmission. But if it's less effective at stopping transmission, then you can't predict it without knowing what human behaviour is going to do over the next few months. And it'll be up to us whether we stop it. And it's our decision. Do we want to stop it completely, or are we satisfied with leaving it as an endemic disease, which we control with a vaccine and therapeutics, and maybe eventually becomes less severe, like a cold? And the thing is, if we can, especially if we can do it in a coordinated way across the world, and if we could come in really hard on it, we can eliminate it. Just an extra few weeks of the public health measures, an entire world doing that. And perhaps, and then again, I think that Biden having a more unified measure from the top. And then, but it's really, if we as the world decide to do this. So try and then, meanwhile, you can do your bit. And you can protect yourself from COVID in the same way with all the variants. And you can also protect others. So don't just think that you're protecting yourself. If you're doing the physical distancing and mask wearing and hand hygiene, you're protecting whatever community that you are a part of as well. And you're like a superhero protecting your community. And if you get it, isolate. Again, you're protecting everyone around you. If you're contact quarantine away from your household, protect your household by quarantining. And if you get it, then disclose your contacts and tell your contacts, and don't wait for the tracers. And if we all do that, then we are protecting our own communities, and as communities around the world, then we can stop it at the community level. We could even do it without the governments like that, apart from the testing, where we do need the governments for the testing. But it's much more effective if the governments are also involved, and all of society, all of government, all of society approach. And then the last thing I want to talk about, and this was the gloomy, I'm not going to bring up, I'll just bring up the title. No, I've down here, I'll put this in a comment. So, yeah, lucky clusters don't mean you're safe. Not going to go into all this because it's in the video, but there we are. This is the gloomy story from the Guardian. So what I have just explained to you just now, The Guardian summarised that as the World Health Organization say that the COVID-19 pandemic is not necessarily the big one, and that the virus is likely to become endemic. I hope you can understand now that's not what they said at all. And the thing about it not being the next big one is certainly the virus has been very sneaky, and if COVID, you could imagine something that's worse than this, that is much more transmissible, but otherwise is the same as COVID-19. But really, if it had been a much worse disease, then we would have been we would have stopped it much faster, I think. Especially if it had been more severe. If it had been something like Ebola, but transmitted in the same way as COVID, but with a much higher death rate, and especially if it happened very quickly as well, rather than 3 weeks late or a month later. If say 20% of people had died within 3 days or something like that, then we would have stopped it. I think there's no doubt about it. Transmitted in exactly the same way. The only difference is that it's much more severe and the results much quicker. And with the same R0 of 2.5 and the same form of transmission and the same way to protect yourself against it, then it would never have spread so far. And really we've seen a big divide in the world between people who thought of it as being like flu and they didn't take it seriously, and people who thought of it as being like SARS, and that's particularly countries with previous experience of SARS, who took it much more seriously. And the ones who thought of it as like SARS, they have the muscle memory of SARS. SARS is a much more severe disease even than COVID, and so they responded very promptly. We don't want another SARS. And it's like Singapore and Taiwan. That's why Taiwan was very, very prompt response, and they never even had to do a lockdown. And the rest of the world could have done that. Across the whole of China, 1.3 billion people, they were doing PCR test turnaround of 4 hours in January or February, I'm not sure when. Somewhere in January or February, they got to the point where you could go into a hospital and you would get your test results within 4 hours. The rest of the world could have done that over that same time scale. We had very small numbers of cases. We could have tested throughout everyone with flu-like symptoms throughout our country and could have tested them in 4 hours, just like China did. We still haven't achieved that. And so the reason is not because we couldn't do it, but because we didn't take it seriously. And we're still not taking it quite that seriously. And then we're using very heavy-handed methods of lockdown to stop it, because we didn't use these other methods, which are much more effective. And that basically is, and because the general public are not taking it seriously, and the leaders are not communicating its seriousness properly to the public, and not very clearly, and not explaining how effective. And sadly, the United Kingdom has developed a muscle memory that lockdowns are the way to stop this. And the United Kingdom is very good at lockdowns, and people do comply with lockdowns for the most part. But it's very poor at complying with the physical distancing and the hand hygiene and the mask wearing. And as a result, the United Kingdom is constantly going into lockdown, or limited versions of lockdowns. And the reason we do that is because people are not doing the physical distancing. And I don't think many people have made that connection in the United Kingdom. They're just partying away and they think, we've got the right to party, why shouldn't we? And then we're in lockdown. Why are we in lockdown? And then lockdown ends. Well, now we can party again. And then, oh, we're in lockdown again. What a drag. And then as soon as it drops, oh, we can party again. And that's really the problem in the United Kingdom, is people are not making the connection and not truly understanding that the lockdowns are the result of the partying and not doing the physical distancing. And that's really the problem that we're facing also in the United States in many areas. So hopefully, gradually, through public education, through people gradually understanding what's going on, they will begin to make that connection that not doing physical distancing is what's leading to lockdowns. And then hopefully we can start doing the public health measures which are much more effective than the lockdown. And see, the thing is that 80% of the transmission is in households. physical distancing and isolation and quarantine can stop nearly all of that. Especially if you get tested as soon as you've got symptoms, isolate, quarantine. Quarantine is if you're contact. Then you can stop the 80% in households. A lockdown only stops the 20% that happens between households. And it only stops some of that because you get many people who don't comply with them. And you get people who are just not taking the right precautions. So the physical distancing and mask wearing is where it's at. And then doing the proper isolation and the quarantine to protect your own household. And if we do that, we can bring it right down again without a vaccine. So, anyway, at least do your bit yourself. Do the complying with public health measures. Make the physical distancing as automatic as the highway code, that you always step back. It's much easier to do it if you make it totally automatic. Don't be judging, oh, it's a bit windy today, maybe I don't need to step back so much. Always step back by the same amount, whatever is appropriate for your region, and just be the stepping back person. And together we can stop COVID and do everything right. I've got these links in the 10 ways to protect yourself that most people don't know. And so I think that we're going to surprise ourselves in 2021. I still think that we're going to have a change of mindset with Biden, and we're going to have, hopefully he's going to show it to the world. And if he does what Jacinda Ardern did in the United States, I think it's going to be it's a very similar culture in the United States to New Zealand. And what Jacinda Ardern did in New Zealand, I see no reason why the same thing shouldn't work in the United States. And she was very surprised. It was really quite surprising. It's much more than expected. That look at tenfold reduction in 25 days. We've got the vaccine to help as well. I think that if we can have a Jacinda Ardern in the United States as president, someone who got, at least on COVID, not on other things of course, but on COVID, then I think the United States might well surprise the world by having a similar very fast drop down once they start to understand this works, and once they start doing the physical distancing and the mask wearing. And in the United Kingdom we could do the same if only people were to do the physical distancing, only they were to wear the masks and the other things that worked in New Zealand. We can stop it even without a vaccine, and with a vaccine we can stop it much faster. And so we do have these two choices: to become endemic or to stop it. We may stop it with the vaccine anyway, if the vaccines can be made more effective at stopping transmission. But apart from, if not, then it's our choice, and we just have to see what the choices the world makes. And that's basically what the world has. But it's a moonshot, and the moonshot did succeed, and we can examine this about 3 months from now. We have a better idea of whether this moonshot can work, and about how feasible it is, and how much impetus there is behind it of actually succeeding at this moonshot.